This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Definitely live in studio, waiting for your phone calls today on any subject that you'd like to hear about. But as long as it's on health and wellness, we're here for you. Give us a call at 888-630-9625. That's 888-630-9625. Love to talk to you and answer any questions you have. But we have a very interesting program, and it's kind of one that tandems into our artificially induced environment that, we're all suffering from. What am I talking about? Lockdowns and COVID and, the scare that everybody's trying to put us under. And it has a tremendous impact on how your body functions on multiple levels. But we're going to kind of expand that idea, and we're going to talk about why you're addicted to the talking heads, why you're addicted to your cell phone devices, why you're addicted to foods and chemistries and chemicals. There's a lot of overlap, and you have to know what to do with it because it's making all of us crazy. We're in that emotional situation. We're going into, oh my God, pattern. And now that the fall is coming in and we have more viral patterns and other colds and flus and rhinoviruses and so forth. And, oh my gosh, the COVID thing is getting crazy. But you know that you're addicted to the negativity that's out there as well as being addicted to positive things. And they can be chemical and they can be emotional, and there's a lot that you can do about it. And some of us get locked into a position where we're feeling overwhelmed and we can't move forward. But you know what? I had the opportunity many years ago of studying traditional Chinese medicine and acupuncture and Asian medicine and so forth. And what I saw was that there was tremendous impact in this area when it comes to addiction, whether it's drug addiction, whether it's food addiction, whether it's an emotional addiction. And who better than to handle this subject than none other than Dr. Zhang. Welcome, my friend.
Hi, Dr. Roselle. Good morning. Good morning, everyone. I'm so happy to be here to talk to you guys about addiction subject.
So let's talk about addiction as a general topic first. Are you seeing in your field, in your area of traditional Chinese medicine and acupuncture, are you seeing more and more people addicted, different types of addictions?
The answer is absolutely yes. It's more and more. Actually, the addiction, the definition is expanded too. For example, before when you talk about addiction, you think about probably just like the drug addiction or smoke or alcohol. But now the time change, the new century, as another addiction, also we have to be very careful too, is about the phone addiction, the electronic addiction. So that's the huge problems especially for young people, young kids. So this bring a lot of issues, cause a lot of emotion problems because I don't know how many my parents came in front of me and said, okay, I'm so stressed. I said, what's going on? Because my kids cannot get rid of the phone.
That's right.
I asked a question. I said, what about you? He just laughed.
That's true.
Yes, I said, okay, whoever listening in front of my the show, I'll ask a question. You don't have to tell me. There's no way you tell me. So how many people cannot use the phone over 1 hour? Just put the phone there. Don't touch the phone 1 hour. I don't think many people can do that.
It's very interesting. Even in my own life, years ago, I was chairman of the International College of Applied Kinesiology. We have 3,500 members worldwide, and until I took that office, I had a flip phone, and so I used it simply for calling people, and maybe I would text somebody. And once I took office, I had to get a smartphone, so I ended up with an iPhone. And because these guys from all over the world had to get a hold of me, and they wanted a response right now, not tomorrow, not tonight, but right now. And, so I got this stupid thing, and I'm always on the phone. I'm always answering, messages from all over the world. And now as you know, I stepped down as chairman a year ago. Mm-hmm. I'm hooked on that thing. I can't leave it alone.
But you're addicted?
But I'm addicted to having that phone because it has tremendous amount of information. I know how to go into different sites, and I can get it very quickly. I have things keyed up. But this is what you're talking about when it comes to this type of thing.
Right. Especially for young kids. We talked about young kids just now. Just talk a little bit more. So the parents said, okay. I said, why are you stressed? Why worried? So because the phone took a lot of time. I said, you know what? This is one thing is to take out a lot of time from the studying or whatever activities. The most harmful thing is blue lights. Blue lights give your brain response, and just like we talked, they can change the cellular structure and cause a lot of ADD, ADHD, all these kind of the emotion problems. I told my parents too, the blue lights, the electronic one, it's just like, it's another abuse.
It's horrible. When you talk about ADD, attention deficit disorders, and attention deficit hyperactivity disorders, and learning problems, and so they're becoming much more significant. And it's not just children; it's adults as well.
Right.
The reason that it hits young children much more impactfully is because they don't have a very developed blood-brain barrier. So they don't have the protection of the brain and that chemistry. But before we get into that, and in the second part of the program, I want to get very specific in some of these areas. But the similarity between this type of addictive patterning with electronics, the addiction to alcohol, the addiction to certain behavior patterns, the addiction to food substances and so forth. Is there a common thread? Is there similar chemistries? Are there similar places within the brain and the body that are affected with all of these things?
It's similar. It's very similar. No matter which kind of addiction, as long as you're addictive to something, it is similar to alter your brain function, which is a prefrontal cortex, change their genetic expressions to let you behave different, let you addict to something. It is similar.
So your prefrontal cortex in the brain, basically, everybody, what we're talking about is you put your head on your forehead. That's what we're dealing with. Mm-hmm. And it's also the part of your brain that distinguishes as consequences of what you do. So if that's not working the way it's supposed to, you don't understand consequences, or you don't react to consequences as quickly. So the addictive pattern, you don't understand that it has an impact. And the younger you are, the more potential there is for addiction. As people get older and that prefrontal cortex develops more impactfully, then the addictive process is less. Talk a little bit about chemical addiction when it comes to how does it affect the body. Somebody, they start drinking, or they start using a drug, or they have, what's the difference, if any, between that and what we were just talking about with electronics?
Oh, good question. So all these kind of chemicals, electronics is just a blue light, just nothing to go to your body. But all the drugs, all these kind of chemicals, if they go to your body, actually, these kind of chemicals were very similar to the chemicals in the brain you naturally produce. For example, the endorphins or dopamine, serotonin is similar. And then the brain will get confused. Which one is mine? Which one is from outside? Right, nicotine, right? they confuse these nicotines from my outside or from my own to producing. So then, but because the brain is confused, then they addict to the specific chemicals to make them happy. Why you addict something? Because you feel good. You feel wonderful. You feel great. You enjoy well-being after taking some chemicals. That's what addictive. So that, from other words, is so because that chemicals are very similar to the we have natural chemicals to make you enjoyable, to make you joyful, to make you appreciate every day, enjoy the well-being. But same thing, if you lack all these things because of some reason, I'll talk about reason later on, because some reason, and then something, the other chemicals from outside the body jump in, then you become addictive right away.
You know, I want to add a little something to what you were saying earlier, because there's another piece that is common or straight across the board. You know, with blue light, with your computers, your computer phones, all the things that were on our devices, they put out, as you talked about, a blue light, right? So this blue light actually puts down the body's ability to produce melatonin.
Correct.
And if melatonin isn't produced at the level it should, your immune system is going to suffer. You can't sleep and restore anything. But in addition to that, you age faster. So all of us that are on phones all the time, or on computer screens all the time and so forth, are dropping our melatonin level, but subsequently we're going to increase our risk of, first, immune system problems, because it suppresses immune function, but also importantly is it causes accelerated aging in the body when we're on these things on a regular basis.
Exactly. The vision loss or vision go down is a directly the result from the blue lights. A lot of people stick on the iPhone electronic devices. Okay, the blue lights affect the vision. This is directly sense can tell you right now. But in the long term, if I didn't notice that until they build up every single day or every single time you watch the electrolytes electronic device.
You know, that whole area of the brain that helps produce this melatonin, it helps control something that we call a rhythm in the body, but there are many rhythms, and we call they're these circadian rhythms, the way our hormones peak and drop, the different susceptibilities that we have seasonally and so forth. It's intimately related to all that. Now we're coming into a season where we're seeing less sunlight, and the sunlight has a direct impact on our immune system and how we feel, our emotional patterns, going to depression states and so forth. And we're going to talk about a little bit about that as well. But here's the situation, is that when we're on these devices and people are, why are we spending so much time on, blue lights and so forth? Because we're coming into a time right now where if you can break some of these addictions, if you will, then perhaps your ability to fight this COVID-19, this coronavirus, will be dramatically enhanced. So we're coming up to break, but I'll ask you a quick question. Are these things that we're talking about, these chemical and electrical addictions, do they impact your immune system? Yes or no?
Yes, big yes.
Okay, we're going to talk about that. Obviously, we're coming up to a break. I want to dig into that much deeper today. We're going to give people a lot of information that they can use. You're listening to Dr. Tom Roselle Live. My guest today, Dr. Qinglong Zhang. We're talking about chemical and electrical addictions. Don't go away. We'll be right back. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live, as you do every Sunday. My guest today, Dr. Qinglong Zhang. We're talking about a very fascinating program, topic, if you will, and that's about addiction. And there's all kinds of addictive patterns. We're going to really get into that in the second part of the program. And, addiction, by the way, in gamblers, right? Gambling addiction. Everybody thinks that they go in the racetrack, they go play cards, they're throwing dice, but there's other types of addictions when it comes to gambling as well. We're in the world right now, and you're hearing all kinds of things on the radio about, learn how to day trade, learn how to, invest your money. Well, these guys, day trading is like quick. It's in and out, in and out, in and out. And once you get bit by the bug, particularly if you're making money, and it's called intermittent reinforcement, you can't break away from it. It's really difficult to do. It's beyond addictive. Some people say that because I'm in the office after 43 years, I never want to leave, and you need to get me out of there. I'm addicted to my practice. That's a different story. I'm doing it for you.
Okay.
But nevertheless, we're going to get heavily into that. I want to be respectful. I'd like to go to the phones first. Linda, thank you for holding. How can I help you?
Hi.
Hi.
Doctor, I have COPD, and I'm wondering how bad is Symbicort? Symbicort is a steroid.
Right.
So I'm wondering not only how bad is that to use, but also what about this turmeric, the actual root, when I make it into a drink and put it in the blender with other vegetables and like greens, and I drink that. Isn't that more effective to deal with inflammation of in my lungs than the Symbicort?
So, Linda, let me give you a couple of things. It's not as simple as take this and, hope for the best. So a steroid, the reason they use it with an asthma patient or a COPD patient is because it's anti-inflammatory effects. Any steroids in the body are going to suppress your own natural production of adrenal function. That's where your steroids come from. So as one product has changed, a natural product for that, steroids have a huge impact, but because of that, they are extremely addictive in this way, meaning if you don't use it, you lose it. So if you don't produce your own, you're going to suppress your body's ability to produce its own anti-inflammatories. And what you really want to do is get that to work again. So in a COPD situation, you want to, and by the way, for our audience, we're talking about chronic obstructive pulmonary disease where the patient can't breathe well. And when it gets really bad, they're on oxygen and the like, and some people up to 4.5 liters or more a day, and it can be quite significant. So immunological responses are not what they should be at that point. But you have to find out what the cause is, and you have to treat that. The intestinal tract, the large intestine, is always involved in a lung problem. So and Dr. Zhang will tell you that, and there's a yin-yang, positive-negative balance. So the lung and the large intestine work together. If you want to actually fix something, you have to go to the place of fixing it. Acupuncture works extremely well with COPD, but you have to change the biochemistry. You have to change the pathways. If you put other anti-inflammatories in place, can they be useful? Absolutely. You would use proteolytic enzymes to bring things down. There are a host of anti-inflammatories. Boswellia is one of them. Curcumin is another. There's many different things that you can look, but it's dependent on the patient and what's really triggering the COPD. Dr. Zhang.
You know what? So I'm sorry to interrupt you guys, but turmeric, especially turmeric, everybody take turmeric right now. So does everybody is everybody okay to take turmeric? The answer is no. For COPD patient, I don't recommend you take turmeric. Curcumin is fine. Turmeric is too cold. So from Chinese medicine, turmeric is a Chinese herb. So Chinese herb have different, they have different things can reduce inflammation. It's all cold in nature. But COPD people generally feel a little bit cold themselves because it's so weak, COPD. So if you take another one, the cold herb will definitely slow down. Definitely slow down the lung function. Getting worse, that sometimes can be.
Yeah, I agree with you. And what happens, so when you talk about something that's hot or cold, what you're saying is something that something that increases the energy, increases the blood flow, increases the body's ability to handle it. In some situations, you need the inflammation to heal. And if you knock it down too far, you can't heal with it.
Thank you. Yeah.
And if it's too cold, that's what you're doing is sometimes you're suppressing the body's ability to respond to the condition. So that's what I was saying in the initial stages. You have to make sure that you pick the right herb for the right situation. If you don't do that, you have a major problem. My guest in studio, Dr. Qinglong Zhang, we're talking about addiction on many, many different levels. But we want you to know it's fixable. You're listening to Dr. Tom Roselle Live. Don't go away. We'll be right back after some very important messages.
Dr. Tom Roselle Live continues now on 105.9 FM WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. We are definitely live for you. You can call us at 888-630-9625. That's 888-630-9625. Love to talk to you. We've got a very interesting and fascinating program. It's called Addiction. You know, what is your addiction? Is it addiction to a chemical? Is it addiction to your iPhone? Is it addiction to something, a habit that you can't stop, you can't break? They all have a similar impact in the body. They stimulate feel-good areas of your body. They affect your limbic area of your brain, that emotional satisfaction area, your ability to judge, which is your prefrontal cortex. But more importantly, in studio or by way to you of Zoom, Dr. Qinglong Zhang, one of our best in the practice. Dr. Zhang, as many of you know, is a doctor of traditional Chinese medicine. He's an excellent practitioner. He does things that just continue to blow my mind. But nevertheless, we're talking about something he has a lot of experience in, and we want to be able to set the stage for you in a very different way. There's several of you on hold right now. We will get back to the phone lines. But Dr. Zhang, let's talk a little bit about, the common aspects of different types of addiction processes. And by the way, before I forget, I want everybody to know that you're doing a presentation that will be available to everyone. And all you have to do is call the Roselle Center for Healing at 703-698-7117 and ask them to hook you up with this thing. It'll be online. You'll be able to get it in a lot of different ways. Additionally, you can go to rosellecare.com, ROSELLECARE.com, Roselle Care. And if you'd like to talk to Dr. Zhang off the air, those are your two ways of making that happen. You can talk to him. He'll call you back and answer your questions personally. But let's talk about what are the common pieces of addiction, whether it's a cell phone addiction, whether it's a drug addiction, whether it's an emotional addiction, even to the point of, things that are not appropriate in the world. So, that people have behavior patterns that they do. So what are the common pieces? Why are they same or are they different?
It's similar. The answer is yes or no. It's similar. So addiction is similar. So same thing. Addiction actually is a long-term. We talk about the long-term disease. Probably the beginning addiction for everything, for anything, for a drug, no matter it's drugs, no matter it's chemical or emotion or phone, cell phone. A beginning of addiction is very, very similar. But however, you don't see too much whatever impact on the people. But addiction is a long-term disease. It can build up. So why? Because we have the addiction. Actually, we take some drugs or chemicals to change your structure on your brain, change your cellular structure outside the cellular structures, and also change the genetic expression. And the long term, you get the same problem, same impact on the patient. The patient get crazy. The patient get a lot of behavior issues, no matter what's the reason. So they have both different reasons. They maybe show differently in the beginning, but in the end, the long term, is still the same thing. They behave a bit crazy, the anxiety, depression, because every addiction causes their brain chemical change thing, the same thing. The dopamine or the melatonin or these chemicals gonna change. And the genetic expression is gonna change, and that make the people, all the addiction people, have similar behavior.
I think about people that, they're good all day long, and then they go home and they're looking for a drink. They're looking for some marijuana. They're looking to do something that will calm their body and break up the stresses of the day and the accumulation of the cortisols and so forth. Instead of going for a walk, instead of going to the gym, instead of putting on some good music, instead of meditating or praying, whatever works the best for them. But they go into something that is quick acting, or the drugs that they're taking. So many patients, as you know, that walk into our practice are on all kinds of different drugs and medications and so forth. I'm going to ask you a question, and then we're going to take a phone call, but then I want you to expand on it. In all kinds of addiction processes, are any of them easier to treat than others? First question is, can they be treated successfully, completely? And are there any that are easier to treat over the others, or are they all about the same?
The first question is yes, they can be treated. But the answer is acupuncture is not only way to treat the problem. We'll combine the nutrition part, different part, because the chemicals. I'll talk a little bit later after you take a phone call. The second one is it's all the same for me to treat. It's all addictions. It's all the same for me. It's not this hard. This is easier. It's this hard now.
We'll keep that in mind. We'll come back to that in a second.
We'll be back.
Robert, Thank you for being extremely patient. How can we help you, sir?
Oh, sure, doctor. My question is on vitamin D and how to get a better absorption to the body. First of all, I want to tell you I don't have a smartphone. I hate looking at that little screen, and I love to look at the blue sky. I'm an artist, but I have to break down and get one because AT&T and my flip phone has charged me triple on long distance overseas calls. But anyway,
because they want to track you, brother. But that's beside the point. Go ahead.
So I have to break down and get because I want to try to go to Italy of all places where my family is this year. But anyway, vitamin D, last year, my level, I raised it up. I made a conscious effort to be in the sun at noon for like 20 minutes, a half an hour without any sunscreen. I also took 4,000 IUs in international units. This year, it dropped. In August, I took more over-the-counter D3, 5,000 IU, but I wasn't in the sun. It dropped to 35.6. I heard on the radio about getting it better absorbed. How do I do that? I take
okay. So obviously your vitamin D level should be above 50. Your sweet spot that you want to get to is at about 75. So obviously it's lower than where it needs to be. So for some people, you need to get up to about 10,000 units a day. I take 10,000 a day, and
wow.
Because of that, it stays in a pretty good place. Now, it has to do with fat metabolism. And so you have to make sure that liver function, pancreatic function is working the way it's supposed to. I have some patients who take a ton and they can't bring up their vitamin D level. The other thing that you have to do is to make sure that you're not sensitive to any of the carriers that are in the vitamin D. So we carry like 5 different kinds of vitamin D. We carry a bioemulsion. We take some that are suspended in oils. We have some that are extracts from food sources that are dry forms. And again, it depends on the patient and what we know about them metabolically. But I'll get a patient that comes in at your level, and I'll put them on 10,000 units a day for about 6 months and then redo the blood work and to see where they're at. And then if they're under 100, I try to keep it under 100. Total sweet spot is 75 to 85, but as long as you're under 100, you're in a good place. At that point, if that's holding right there, I'll let them continue taking 10,000. Now, if you're outside all the time and you're getting sun and you're taking a little extra vitamin D, and then you can get away with less. But once you break that pattern of being outside. Now, here's the other thing most people don't realize when they're outside is that as soon as you wash your body with soap, your body now becomes less receptive to the sun stimulation of the vitamin D through what's called the melanocytes within the skin tissue. The other piece is that at this latitude where we live in the Washington metropolitan area, the sun is on such an angle that after September till about the end of April, you don't have the ability to stimulate as much D because it's on an angle, and then you have to take individual people into consideration. For example, anybody who has dark skin, African Americans, South Americans, and so forth, their skin is more resistant to stimulation because that beautiful dark skin that they have was meant to protect them in the tropics. So, if I went down there, I'm Sicilian, by the way, you're going to my homeland when you get to Italy. if if I went to the tropics, even though that I'm first generation of this country, my skin is not very deeply olive, and I'll burn. But I go with one of my best friends who's a very, very dark African American, and I laugh at him because he can go out in the sun all day long, and he gets, "Oh, I'm burned." I said, "Where? Show me." And so we laugh back and forth, and it's because he can't stimulate vitamin D, his immune system is less resilient. And he has to be very careful. So that's part of it. If you put suntan lotion on and you go outside, you have to get a lot of sun on your body and direct sunlight for those melanocytes, those vitamin D receptors, to be stimulated. We used to be able to get it from food, but today not quite as easily. So what I would say to you is don't be afraid of taking it. If it's down that low, you get a good, natural, organic form of vitamin D, take it. And then I would tell you within about 6 months, retake it. Now, if you're above that level, if you go, if you're having to take 12, 15,000 units or so to keep your vitamin D level adequate, that's a different story. Then we got to dig deeper. We got to look at your liver function. We have to look at some of the receptors within the body. But if we can help you further, give us a call, and more than happy to shed a little bit more light on the subject. Dr. Zhang, let's go back a little bit to what we were talking about.
Yeah. So what about you asked me the first question is, can this addiction be treated? The answer is yes. So actually, acupuncture came to US about 1980 something. Actually, the first thing they came here to treat is addiction. And then since, the past 3 decades, the NADHDA, which is National Acupuncture Detoxification Association, develops a very detailed protocol to treat addiction. That by the way. Okay. So acupuncture is, but however, acupuncture not only the only way to treat the addiction people, because when you have addiction, your brain chemicals change, your serotonin, melatonin, the dopamine, endorphin, all these things get messed up. But remember, gut is second brain, and a lot of neurotransmitter, over 85% neurotransmitter, meaning the gut goes to your brain, right?
It's restored in the intestinal tract, and we used to think that those neurotransmitters that were in the intestinal tract didn't affect the brain, that they went other places in the body, but we know in fact that it does. That's where the majority of it. So if your intestinal tract's a mess, you got a problem.
Yes, that's why we have to combine the diet and then treat the people, and combine the diet. Same thing. If you have a lot of addiction people have very bad gut and they cannot sleep very well, and they have very bad gut, get a lot of inflammation in the gut, we have to detox the gut. That's why the second question is it to be treated differently? I said, no different. But yeah, from the other side, when I say no different is, I would say, okay, we treat addiction people, we use acupuncture, the diet change, and detox. But however, this is no difference. It's the same. However, based on different people, the age group are different, the different addiction to drug or emotion or the electronic. When I do needles, that's a different age, where the different is. So I pick up different points to treat different people. Everybody's different. There's no same leaves in the whole world, right? So everybody's different. Then the difference is we can do the diet change based upon the age group, based upon the gender, and to balance your gut, then detox yourself, and they then put it together, then treat the addiction problems.
Let's hold that thought. I want that we have another caller that is on similar subject, so not so much addiction, but on chronic obstructive pulmonary disease. James, thank you for calling, sir, and being patient. How can we help you?
Oh, thank you very much for taking my call. I have just a very quick question. You had mentioned that turmeric is not good for COPD, and I have COPD. Could you specifically state what herbs are good? And I'll take your response offline. Yeah.
So James, what's going on is simply this: there's a lot of herbs that work extremely, extremely well for many different types of inflammatory reactions and inhibitions. But as I said earlier, you want to make sure that you're finding, the right one for you. When we, turmeric is a cold herb in Chinese medicine, and curcumin is a warmer herb. It brings up the energetics. It helps heal the body. Dr. Zhang and I were talking offline, and I was laughing at him, and I said, he always tells me, that I have to watch my red wine. And the substance within red wine is resveratrol, and that increases your anti-inflammatory reactions. But, there's supplements for that as well. Being Sicilian, I like a glass of dry red occasionally, but we also there's a substance, Dr. Zhang, a tea that is extremely alkalizing and subsequently decreases inflammation across the board. Why don't you tell everybody what that is?
Is it green tea the best one?
Green tea.
Green tea is the best one.
Yeah, you walk in the office all the time and make sure that I have a cup of green tea going on.
Oh, yeah.
But green tea is important. So if we had to say, curcumin is good and green tea is good, and there's other things, skullcap, boswellia, white willow bark, probably
fish oil,
fish oils,
even ginger, believe it or not, ginger
and ginger. Any anti-inflammatory approach should incorporate a fish oil, but you have to be careful of the fish oils. They have to be extracted from good areas. They have to be well balanced, omega-3, 6, and 9s. If you're working on brain inflammation, you want to make sure that it's loaded with DHA. But again, we're giving you a list of things. We're not prescribing, and please make sure that you understand that this is a subject, and we're talking about addiction, and these things would work as well depending on the site. We're coming up to a break. I wish we had about 2 hours to talk about this today, but we're going to make this program available to you. You're listening to Dr. Tom Roselle Live. Don't go away. We'll be right back.
Washington's Mall, 105.9 FM, WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. This is a fascinating program. You tune in every Sunday at 11 a.m. on the Eastern clock, and we try to give you things that will not only interest you but provoke you to take action in your own lives. And today's subject is no different. It has to do with addictions. And we want to thank all of you for being present on an ongoing basis, and tell your friends about the program, because this is for you. This is giving you the tools that we need to have. Dr. Qinglong Zhang is my guest today, one of our best in our practice, doctor of traditional Chinese medicine, as well as chiropractor, acupuncturist. This man has everything that it needs to help you. But we're talking about addictive patterns, whether biochemical, emotional addictions, and so forth. And this week's presentation will be available to you, by the way. And all you have to do is call the office, 703-698-7117, 703-698-7117, or simply go online at rosellecare.com. That's ROSELLECARE.com, rosellecare.com, and sign up for the program, and you'll be able to get the link to watch this. Dr. Zhang, what will our audience learn if they ask for the program? What are you going to be presenting? What will they be able to appreciate by it?
Okay, so I will have 4 sessions. The first session is talk about what's the addiction. So how you can definitely the addiction. So somebody maybe now didn't notice that they have addiction. Okay, the second session is I will talk about how harmful addiction is. How can they affect you? What's going on, the biomechanism behind the addiction. And the third part is we'll talk about how we can approach to treat, improve their symptoms after you have addiction to reverse that addiction. Okay, different treatment protocol. The last but not the least, I always give to my audience, my loved people, is the tips. So from Chinese medicine, we have a lot. Remember, Chinese medicine is developed to prevent disease instead of treat disease too, right? And treat disease. So I'll give you some tips to bring home to help yourself, to some good exercise, good tips to help you get rid of addiction. It's very simple. You can do by your own. You can do even those things in the cars. I keep it very, very simple, but it's very powerful.
Your presentations are always right on the mark. And, it's simply because you bring such a tremendous background. You worked in the hospitals in Shanghai for quite some time, before you came to the United States. So you have the best, if you will, of both worlds, and you're able to touch people and you're present in their lives. And, as you know, there's no one treatment that fits everybody. No. And you, more than anybody else, I'm always amazed at how you can pick things apart and be able to say, this is where we need to go with this. And, you don't compromise your care, which is absolutely amazing. So if you want to really learn something, and that's what all these programs are about, is to educate you to be able to have the information to take control. And by the way, my book, Ageless Health, Health is a Do-It-Yourself program, was really about that. It set the cornerstone for everything that we're doing for you. And it's been out now about 6 years, but it's still available. You can get it through our office or you can get it online. But listen to Dr. Zhang this week. Ask for this program. Share it with your friends. It's important. Dr. Zhang, thank you very much.
Thank you.
We're going to put this together for everybody. And remember, we do this for one reason and one reason only, is that we love you all.
Have a good weekend.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.